Hello everyone and welcome. I'm Dr. Asim Hussein and I'm glad you're here today. We'll be discussing toxicology emergencies, specifically focusing on methanol and ethylene glycol poisoning. This is a critical area in emergency medicine, and I look forward to sharing important insights with you. Over the next few minutes, we'll cover the key aspects of these poisonings, including their identification, management, and prevention. So let's get started. Let's take a closer look at this case. We have a 52-year-old man presenting with vomiting, abdominal pain, and confusion. His arterial blood gas shows a pH of 7.1, which indicates significant acidosis. The bicarbonate level is quite low at 8 mmol/L, and the anion gap is elevated at 30. This suggests a high anion gap metabolic acidosis. Notably, his serum ethanol level is negative, so ethanol poisoning is unlikely. Also, his osmolar gap is markedly elevated, which is a key clue here. The osmolar gap is the difference between the measured serum osmolality and the calculated serum osmolality. A high gap suggests the presence of unmeasured osmols, often toxic alcohols. Now, considering these findings, metabolic acidosis with an elevated anion and osmolar gaps, along with negative serum ethanol, we need to think about other causes of toxic alcohol ingestion. These include methanol or ethylene glycol poisoning, which are classic culprits in such presentations. So, connecting all these points, the most likely diagnosis here is methanol or ethylene glycol poisoning. This highlights the importance of recognizing the pattern of high anion gap acidosis combined with an elevated osmolar gap, as it points toward toxic alcohol ingestion. This understanding is crucial for timely diagnosis and management in cases like this. All right, let's dive into this case. The correct answer here is option C when we see a high anion gap metabolic acidosis combined with an elevated osmolar gap. It really points us towards toxic alcohols, specifically methanol or ethylene glycol. These substances can cause significant metabolic disturbances, and recognizing this pattern is crucial. The high anion gap indicates the presence of unmeasured acids in the blood, often from these toxins. Meanwhile, the elevated osmolar gap suggests there's an osmotically active substance, in this case, the toxic alcohols, that isn't accounted for in standard labs. Connecting these clues helps us identify the likely cause quickly, which is vital for prompt treatment. This pattern underscores the importance of understanding toxic alcohol poisoning as part of our overall approach to metabolic acidosis. Let's take a closer look at this question. It asks us to identify which metabolite is responsible for visual toxicity in cases of methanol poisoning. Now, among the options listed, formaldehyde, formic acid, oxalic acid, glycolic acid, and acetone. The key player here is formic acid. When methanol is ingested or absorbed, it's metabolized in the body into formaldehyde initially, but it's the subsequent conversion into formic acid that really causes the damage. Formic acid is particularly toxic because it affects the optic nerve, leading to visual disturbances and, in severe cases, even blindness. This is a critical point to remember because the visual toxicity in methanol poisoning is a hallmark feature and is directly linked to the accumulation of formic acid. Understanding this helps us grasp why prompt diagnosis and treatment are essential, especially to prevent irreversible damage. So, the correct answer is B, formic acid, because it's the metabolite responsible for the visual toxicity associated with methanol poisoning. Let's take a closer look at the correct answer, which is B now. The key point here is understanding the metabolic pathway of methanol poisoning. When methanol is ingested, the body metabolizes it into formaldehyde, which is then further converted into formic acid. This buildup of formic acid is particularly dangerous because it leads to two major issues. First, it causes optic nerve toxicity, which can result in visual disturbances or even blindness. Second, it causes severe metabolic acidosis, disrupting the body's acid-base balance. Recognizing this pathway is crucial, as it explains the clinical symptoms and guides us toward appropriate treatment options. Remember, this metabolic process underscores why methanol poisoning is so hazardous and requires prompt intervention. All right, let's look at this question. We're dealing with a patient who is suspected to have ingested ethylene glycol, and the arterial blood gas shows severe metabolic acidosis. Now, ethylene glycol poisoning is a serious emergency, and recognizing it quickly is crucial. The key here is understanding the toxic metabolites of ethylene glycol, which cause the metabolic acidosis. The main goal is to inhibit the formation of these harmful metabolites. So, among the options given, we need to identify the most appropriate antidote that blocks the metabolism of ethylene glycol. Fompizole is a specific inhibitor of alcohol dehydrogenase, the enzyme responsible for converting ethylene glycol into its toxic metabolites. By inhibiting this enzyme, we prevent the formation of metabolites that cause acidosis and renal damage. While other options like activated charcoal can absorb some toxins, they aren't effective for ethylene glycol poisoning. N-acetylcysteine, flumazenil, and naloxone are used for different toxicities and won't help here. Therefore, the best choice in this scenario is fompizole, as it directly targets the metabolic pathway responsible for the toxicity. This highlights the importance of understanding the pathophysiology to select the correct antidote. The correct answer here is C, and I want to explain why. Fompizole works by inhibiting alcohol dehydrogenase, which is the enzyme responsible for metabolizing certain toxic alcohols. By blocking this enzyme, fompizole prevents the formation of harmful metabolites that can cause serious toxicity. This is a crucial point because it highlights how fompizole acts at an early stage in the metabolism process, essentially stopping the cascade of toxic effects before they develop. Understanding this mechanism is key in managing poisoning cases effectively, as it underscores the importance of timely administration to prevent further damage. So, remember, fompizole's main role is to inhibit the enzyme, thereby preventing the formation of those dangerous metabolites that can lead to severe toxicity. Let's take a closer look at why ethylene glycol poisoning often leads to acute kidney injury. The correct answer here is B, myoglobinuria. When someone ingests ethylene glycol, it gets metabolized into toxic compounds that can cause significant damage to the kidneys. One of the key mechanisms involved is muscle breakdown, which releases myoglobin into the bloodstream. This myoglobin then gets filtered by the kidneys, leading to a condition called myoglobinuria. Myoglobin in the kidneys can cause obstruction and oxidative damage, which impair kidney function. This is why we often see acute kidney injury in cases of ethylene glycol poisoning. It's important to understand that while other options like vasoconstriction or crystal deposition can contribute to kidney issues, the primary pathway here involves muscle breakdown and myoglobin release. Connecting this to the overall theme, recognizing the signs of myoglobinuria can help us quickly identify and manage ethylene glycol poisoning to prevent or mitigate kidney damage. All right, let's look at the correct answer here, which is C now. The key point to understand is the metabolic pathway involved in ethylene glycol poisoning. Ethylene glycol is metabolized into oxalic acid, and this oxalic acid then forms calcium oxalate crystals. These crystals are problematic because they can deposit in the renal tubules, leading to direct tubular injury. This injury ultimately results in acute kidney injury, or AKI. Recognizing this pathway is crucial because it highlights how the metabolism of certain toxins can cause specific tissue damage, which is a central theme in understanding poisoning mechanisms and guiding treatment. Let's look at this question carefully. We're asked, which finding is an indication for urgent hemodialysis in methanol or ethylene glycol poisoning? Now, as we consider the options, it's important to focus on the most severe and life-threatening signs. Option A suggests visual disturbance and severe acidosis. These are actually classic signs of methanol poisoning, since methanol metabolites can cause optic nerve damage and metabolic acidosis. Option B, isolated vomiting, while concerning, is less specific and usually not an immediate indication for dialysis on its own. Option C mentions mild metabolic acidosis with a pH of 7.32. While acidosis is important, mild acidosis alone typically doesn't warrant urgent dialysis unless it's worsening or accompanied by other signs. Option D, normal renal function, is reassuring and doesn't indicate the need for dialysis. Finally, E states ethanol detected in the blood. Ethanol can be used as an antidote, but the presence of ethanol itself isn't an indication for dialysis. So, the key point here is that severe visual disturbances combined with significant acidosis point to a critical situation where urgent hemodialysis is necessary to remove the toxins and prevent further damage. This highlights the importance of recognizing these critical signs early in poisoning cases and connecting them to the overall goal, preventing irreversible injury and saving lives. Let's take a closer look at the correct answer here, which is option A. Hemodialysis is typically indicated in cases of severe acidosis, where the blood pH drops significantly and can't be corrected easily. It's also used when there's end-organ toxicity, particularly affecting the visual or central nervous system, which suggests that toxins are building up to dangerous levels. Additionally, hemodialysis is essential in cases of renal failure, when the kidneys are no longer able to perform their normal functions. Lastly, it's indicated when toxin levels are extremely high, posing a serious threat to the patient's health. Recognizing these key situations helps us determine when hemodialysis is the most appropriate intervention. This ties into the overall theme of understanding critical treatments based on specific clinical scenarios. Let's take a closer look at some of the toxic alcohols and their effects. As you can see in this table, methanol is converted into formic acid, which primarily affects the eyes and the central nervous system. This is why methanol poisoning can lead to visual disturbances and even blindness if not treated promptly. On the other hand, ethylene glycol is metabolized into oxalic acid. This substance tends to target the kidneys, often causing severe renal damage. Recognizing these key organs affected is crucial for diagnosis and treatment. Understanding these toxic metabolites and their target organs highlights the importance of early intervention in cases of poisoning. It also underlines the need for proper handling and storage of these substances to prevent accidental ingestion or exposure. Overall, being aware of these mechanisms helps us better prepare to manage and treat such poisonings effectively. When evaluating a patient with suspected toxic alcohol poisoning, there are several key clinical clues to keep in mind. First, we often see a high anion gap metabolic acidosis, which suggests the presence of an unmeasured acid in the blood, commonly from toxic alcohol metabolites. Additionally, an elevated osmolar gap can be a crucial hint. It indicates the presence of osmotically active substances like methanol or ethylene glycol that haven't yet been fully metabolized. Visual disturbances are particularly characteristic of methanol poisoning, often presenting as blurred vision or even blindness in severe cases. This is a distinctive feature that can help differentiate it from other causes of acidosis. In cases involving ethylene glycol, we might see acute kidney injury and hypocalcemia. Ethylene glycol's metabolites can cause renal damage, and the depletion of calcium leads to hypocalcemia, which can manifest as neuromuscular irritability or cardiac issues. Overall, recognizing these clues, metabolic acidosis, osmolar gap, visual symptoms, kidney injury, and electrolyte disturbances are vital for diagnosing toxic alcohol ingestions quickly and accurately. It's these clinical signs that guide us toward the correct diagnosis and prompt treatment. Let's talk about the management of toxic alcohol poisoning. The first-line treatment is fompizole, which works by inhibiting alcohol dehydrogenase, the enzyme responsible for metabolizing toxic alcohols. If fompizole isn't available, ethanol can be used as an alternative because it competes for the same enzyme, slowing down the formation of toxic metabolites. In cases where acidosis is present, IV sodium bicarbonate is administered to help correct the acid-base imbalance. And in severe cases, especially when there's significant toxicity or renal failure, hemodialysis becomes necessary to effectively remove the toxins from the bloodstream. Overall, timely and appropriate management is crucial to prevent serious complications, and understanding these treatment options helps us better care for patients with toxic alcohol poisoning. Let's talk about some ICU pearls today. First, you'll notice that the osmolar gap tends to fall as the anion gap rises. This inverse relationship can help us track the progression of toxic alcohol poisoning. Next, it's crucial not to wait for toxicology confirmation if your suspicion is high. Treatment decisions need to be made promptly to prevent serious harm. Also, the presence of crystalluria can be a key clue. It suggests ethylene glycol poisoning. Recognizing this early can be life-saving. And remember, administering the early antidote is vital. It can prevent irreversible damage and improve patient outcomes. Lastly, when dealing with toxic alcohol ingestion, understanding these key points helps us act quickly and effectively, ultimately saving lives. Thank you so much for your attention today. I really appreciate your time and engagement throughout this presentation. I hope you've gained valuable insights and a clearer understanding of the key concepts we've discussed. Remember, the ideas we've explored are all about driving innovation, improving processes, and ultimately making a positive impact in our field. If you have any questions or want to discuss further, I'm here to help. Thanks again for being such a great audience.